Good evening, everybody. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. Hair is the first thing that people generally notice about you. A great hairstyle can give you the personality boost you require in both personal and professional fronts. Black and lustrous hair is the crowning glory that you would never want to take off. But have you noticed many people, especially young generations, started developing gray or white hair quite early in life? This is scientifically known as premature graying of hair, PGH. It starts before 25 years of age and it can severely affect the self esteem of an individual. It can be a shock to find your first gray hair on your head, especially if you are only in your 20s. The prevalence of premature graying of hairs, PMGHs, was found to be as high as 27.3%. Thankfully, effective hair treatment and early consultation from the expert can actually control this process. But what remains the concern is the awareness of this hair concern. We are here to know more about the PHG, that is premature hair graying, from an expert. So let's connect today with our expert, Dr. Gulshant Panesar, live from Delhi to make us aware on premature hair graying, a concern. Dr. Gulshant comes with a very rich experience of more than 25 years. She completed her MBBS followed by MD from Lady Hardinge Medical College. She is senior consultant dermatologist, Moolchand Hospital and Max Smart Hospital, and senior consultant dermatologist and advisor at Kaya Skin Clinic. She was invited as speaker, chairperson, and panelist in many international conferences. She was also part of many shows as an expert aired on Darshan, Tata Sky, etc. She has many published papers in her credit as well. Hair disorders and aesthetic dermatology are her areas of special interest. It's such a pleasure to have you with us, Dr. Gulshant Panesar. A very warm welcome to you.
Thank you for a nice introduction. I am Dr. Gulshant, and very good evening to all of you. And as you all know, we are celebrating August as Hair Awareness Month. So this is in line with the current the commemoration that we are having in dermatology. So we can start.
Yes, doctor. And as you very well said, hair is definitely a big concern for all of us in our day-to-day life. We go through so much of stress, so much of environmental problems, etc., that we can see the impact on our hair in terms of hair loss, etc. And premature hair graying is definitely one of the biggest concerns. So, doctor, first of all, let us know what is exactly this premature hair graying.
See, hair is a crowning glory, and we are living in the times when the appearance is everything. So hair has got natural pigment, which can be in Indians usually black, which we call as eumelanin, and in Europeans and the Americans it can be yellowish, reddish, or blonde, which is known as pheomelanin. So premature graying of hair is when the hair loses its pigment, whatever pigment it has, and the keratin that the hair has, that shows through, which is yellowish. So it gives a very dull look. So by definition, if when do we say that some graying is a part of natural aging process also? So when do we call it premature is the question. So if in Europeans, if they turn gray before 20, we label it as premature. For Asians, if they turn gray before 25, we label it as premature. And for Africans, if they start getting gray hair before age 30, we take it as premature graying of hair. So when do we actually start graying is genetic. So it's obviously later in Africans. So that's why our definition is flexible on that count. And some gray is part of aging, we all know. So per se, aging is also, graying is also an aging process.
Definitely, graying is an aging process, and as we know that with age, our skin get very soggy, or we get wrinkles, etc. The same way, we also get gray hairs. But yeah, definitely, premature hair graying is a big concern because youths who are in their 20s, or as you said before, 25 for Indians, definitely, it's a big thumbs down to their self esteem. Now, doctor, what are the future consequences of the same?
So, see, as I said, we are living in an world in the times when appearance is everything. So, premature gray, when we see first strand of gray and let's say late teens, the earliest that I have seen in my clinic was a child also, young child, I mean, very small child, around 5 years of age, also presenting with gray hair. Or it is more of a concern in teens sometimes because as early as 15, 16, 17 they start to develop gray hair when there should not be a single strand of gray. So even at that point of time, if even less than 10% of the hair are showing gray, are turning gray, it is a cause for concern because it is also cause of low self-esteem. The patient, should we call them patients or what? They feel less adjusted because they are being judged by others. And maybe some for females, they may be perceived older than they actually are. So that is not a very comfortable feeling when they're not that old. And suppose they start to gray in late teens and that by mid 30s, they are almost more than 50% gray. So incidentally, we have a rule of 50, which says that in generally by 50% of the hair are gray in 50% of the individuals. So we have a rule of 50. So if they are turning graying by 35, it's a cause of loss of self-esteem, and there's definitely it lowers the quality of life. So it merits treatment.
Right. And we are seeing a rapid increase in the number of people, especially, teenagers or people who are less than 25-year-old having gray hair. That's why we are talking on this very topic of premature hair gray. Now, why and, how do young generation is getting this gray hair, and why the cases are rapidly increasing these days, doctor?
So there are many causes of graying of hair. Uh, the main cause is genetic. Then there are other, as doctors, we should also see the underlying cause. So it can be genetic, it can be nutritional, it can be lifestyle associated. At times, it can be associated with an underlying autoimmune disease. It can also be associated with certain medications that the patient is taking. Suppose the patient is consulting for premature graying of hair. So just to label that it is premature and start the treatment is not the thing. We have to take a detailed history as to what is the lifestyle of the patient, whether there is a family history of early premature graying, whether there is an underlying disease that we are missing. Usually it can be thyroid disorders, and if there is underlying nutritional deficiencies that we are missing, so usually B12 deficiency, copper deficiency, and calcium, and sometimes even vitamin D3 deficiency, iron deficiency are associated with gray hair. So we should take a detailed history. So when you interview the patient, usually it gives pointers as to what could be the cause of the premature graying. When we are not able to find out any cause, so there is an isolated disorder which causes graying of hair, which is an autoimmune disorder which causes graying of hair. But otherwise, there are a lot of other autoimmune disorders in which hair can gray. They are like McCune Albright and vitiligo and Shediac acid. They are very tongue twisting autoimmune disorders in which the graying of hair can happen. So, obviously, if they are there will be pointers or there will be symptoms of those diseases as well. But we, as a thumb rule, we should rule out a thyroid disorder. We should rule out nutritional deficiencies. We should ask for genetic history, family history, that is, and we should be also asking about lifestyle. So, smoking is a very important cause of premature graying of hair, as also stress. So stress is a very big implicator of graying of hair. So these are the general ways when we evaluate a patient who is seeking treatment for premature graying.
Right. So it's important to diagnose the cause, and for that we need to go and consult a qualified dermatologist so that we exactly know why it's happening. But do you feel, doctor, the awareness regarding this is less, or people are not that aware and they are doing, trying to fix it on their own?
So, see, awareness is there, and patients are also disturbed of it, but they take it lightly. They think that it's okay, like everybody. Since there's another thing that in lifestyle which I would like to add, that people are doing a lot of chemical treatments of their hair also. So they are aware that hair is graying, but they take it lightly. They are not associating that it could be associated with something more sinister, or they could be an underlying disease. That part they don't associate it with, because nowadays there are even associations, though they are not proven, that it's underlying cardiovascular risk or osteomalacia, or like that thinning of bones, but they don't associate. They think that okay, it is aging, and it will sooner or later it's going to happen, so if it's happened sooner, we'll just treat it. The other thing is the kind of stressful lifestyles we lead, and also the too much of chemical treatments and too many frequent change of colors that we do also contribute to the problem.
Right, because you mentioned about these, chemical treatments, coloring, etc. Doctor, any shortcut methods that is or are big no to do in premature hair graying?
Big no is too much of chemical treatments that we do, because it's to educate, since it's hair loss awareness month, everybody should know that when you go in for coloring, they are the dyes that you do, they are permanent dyes, and then they break open the cuticle of the hair, and there's a full oxidative reaction that takes place, and that can weaken the shaft and lead to thinning and frizzy hair in the long run. If you're doing too frequent colorings, if you're doing too frequent straightening, they use ammonia and formalin and all sorts of chemicals. So any sort of too much of these parlor treatments and straightening treatments and chemical treatments definitely contribute to the hair problems. And then the other thing is to keep stress low. So a very good way of keeping stress low is regular exercise, paying attention to your diet, and your sleep and exercise regime. Yeah.
So a healthy lifestyle also contribute to
definitely
preventing premature hair graying. And doctor, many times nowadays we see a lot of crash dieting or influencers, asking you to say, diet or be on fast for long hours and eat for very minimum time. I'm not going to name all these diets, but there are a lot of diets are in trends. People are also getting deficient on various vitamins, etc. So any vitamin or diet change, can it also lead to this?
Definitely. I've told you the cause of premature graying being genetic, nutritional, underlying disorders, drug-induced, stress-induced, free radical oxygen, scavenging induced. So nutrition, when you are on diet, I told you there are certain vitamins which are associated with premature graying of hair. So a normal balanced diet is very essential. If you are fasting, you're doing intermittent fasting, as long as when you're eating the right things and not junk, that's important. As far as vitamins are concerned, there are certain vitamins which are definitely associated with premature graying. I mentioned that amongst that is B12 deficiency. Amongst that is vitamin D deficiency, iron deficiency. That it's not just iron deficiency. At times, the iron stores, which is measured as ferritin. So maybe that ferritin iron stores are low. Or calcium deficiency. At times, copper deficiency, selenium, manganese, zinc are also trace elements. So when you are eating, and if you're even very want to lose weight or whatever, you can always incorporate grains or seeds like flax seeds or chia seeds and all of that, because they have phytoestrogens and they have essential fatty acids, and they're good source of these trace minerals, which are copper, manganese, zinc, because they are present in nuts and seeds. And and they are required in very low quantity. You don't have to be eating them all the time. So they little bit of 1 teaspoon also can replenish. So that way you can always go to a doctor. They can even supplement it with nutraceuticals nowadays, which are quite good ones. And rest, if you pay attention to having your regular meals, which are not processed food, and exercising and keeping stress at check, I think you can at least delay, and unless it's genetic, where you can't do much, unless you do gene therapy, which we are not very advanced at right now. Yeah.
Right. So again, your good lifestyle, a balanced diet is what you require to prolong or delay PHG. Now, doctor, this saying comes from very old time that you should not pluck your gray hairs. So what are your thoughts behind this?
See, now, since we've discussed so much about premature graying, we should understand that hair is the coloring of hair, the melanin that the hair has got cycle. It's got anagen, catagen, and telogen. And the color of the hair is due to something known as melanin, which is being formed by melanocytes, which are very fragile cells. So one melanocyte gives give color to 5 hairs. So that's known as a hair follicle melanin, the hair follicle pigmentation unit. So the question, what were you asking? What was the main thing? I forgot.
Yeah, I was talking about the old saying that, you should not pluck your gray hairs.
So if the melanocyte is intact, that's there only in the hair bulb. What you're seeing is the shaft. So if the hair bulb, if the melanocyte is intact and it's getting its nutrition and it's giving color to the hair cortex, the hair will be colored. So plucking out from outside doesn't make any difference. Scientifically, it makes no difference. If the melanocyte is intact, the hair plucking there is a misconception that if you pluck one hair, 5 or 10 more gray hair will come. Right. But that's not the case. In fact, if the hair is less than 10% gray, plucking is one of the treatment options in association with certain medicines. So plucking will not if your hair root, just the hair bulb, where the melanocytes are, if the melanocytes are healthy and they're intact and they are giving color to the anagen hair, the hair will be colored, irrespective of if you cut or pluck.
So it's just a misconception, a myth that you should not pluck your gray hairs. Okay. And now, doctor, we also spoke about chemical dyes and how color can, damage our hair further. But then the fact remains that people, or especially young generation, is going a lot for chemical dyes, colors, etc. So does chemical dyes, color really help overcoming the gray hair?
They're not overcoming the gray hair. Gray hair has to be treated if it's premature. There's something known as camouflage. They're camouflaging it. The hair has already lost its natural pigment. As I said, if the melanocyte is healthy and scalp hair grows for 1 to 3 years, and only during that growth phase is melanin being transferred to the hair. So if the melanocyte is healthy, no matter what you do, the hair will come out as pigmented. So when you're coloring, these are the dyes can be vegetable dyes. They can be temporary. They can be semi-permanent. They can be permanent. So the temporary ones just coat the hair. It's not a treatment. It's like camouflage. They're gray. You don't like it, so you camouflage it by dyeing. So the dye, obviously, even a permanent dye, the hair regrows back, so the roots start to show. So you are just camouflaging it. Your root is still gray. So there's a lot of research going on where we can make the root itself, where we may be able to regenerate the melanocytes from their stem cell precursors. So where we are able to color the root, that will be the permanent treatment. But as of now, dye is a camouflage. So if you're using temporary dyes, there's no chemical reaction. There's no oxidative reaction. They just coat by weak forces. They coat the hair shaft, which are Van der Waals forces. The hair shaft gets coated. But if you are using chemical dyes, they open the cuticle. they bleach out the natural pigment, the pH, the ammonia is there, and the pH becomes alkaline, then there is a fresh coating of the color, which is usually a chemical paraphenylene diamine or aminophenols. And then there is a closing of the cuticle. So the whole reaction takes place. And when you're repeatedly using it, it definitely will weaken your hair shaft. So the hair shaft becomes weak, it will become brittle, and the hair thinning would eventually happen. And see, if your hair is gray and it's absolutely essential, you're very conscious of it, that time you're coloring your hair, it's fine. But just to look, I mean, you want to become blonde or you want to change your color and you're coloring it, so you should give it a thought, because repeated coloring definitely will lead to weakening of the shaft and thinning in the long run. And now there are studies which associated with certain cancers as well, but they are not proven studies. So we can't really, I mean, there'll be more studies to say that, because many people are coloring for whatever reason.
Right. And then, market is flooded with products that contains ammonia, and you also initially, spoke about it. But as we know, people, especially middle class people who don't want to go and spend in parlors, etc., they'll just go buy these, colors or dyes which contains ammonia, and they'll keep on applying it. Yes. Market is flooded with such products. So, what are your suggestions for such products with ammonia?
No, we normally we do advise to use ammonia-free colors. A lot of good colors. Actually, the main coloring agent still remains paraphenylene diamine. The good colors, the advantages that they have other added hair conditioning agents added to protect the shaft, so to say. So as far as possible, you should use ammonia-free colors. There are certain colors which mention that they are ammonia-free. So we do advise you use ammonia-free, because it makes a pH to alkaline. It will definitely weaken the cuticle. The cuticle will get destroyed. So ultimately, the hair will look very dull and frizzy if it's colored very frequently.
Okay, doctor. And doctor, now we would like you to shed some light over the treatment options available for premature hair graying.
So a treatment here again, since it's something which is a crowning glory, it should be approached more holistically. So as I said, we should take account of the lifestyle. We should take account of the diet. We can measure the serum ferritin. We can measure vitamin D levels, B12 levels, and supplement. So normally, as a dermatologist, I would supplement B12. I would supplement D if it's deficient. I would give biotin in the desired dose, because it's good for hair growth. And then there are tablets. There's vitamin B5, calcium pantothenate, which is said to halt the graying or reverse the graying. But all of these treatments have to be taken for good 6 to 9 months or maybe longer. And then if supplementation, then even there are certain topicals that we apply locally. So that can be, there's too much research on polyphenols and green tea extracts and flavonoids and peptides and amino acids. So there are a lot of hair serums which you can apply in that area, where the graying is there. And that will, maybe stop further aggravation of the problem. So it's basically medical treatment, nutritional supplementation, and modification of lifestyle. So if we tackle all of these, it's more like a holistic approach. The patient, if he's and also if the patient in Asians, if they're already 30, we don't give treatment, because then they don't technically fit the definition of premature graying. So they have to gray depending on their genes. So if the patient is less than 25, we can definitely stop their graying.
No.
And also rule out any endocrine abnormalities, like if the patient has got an underlying thyroid issue, and evaluate the patient, investigate the patient, correct their deficiencies, advise them about lifestyle change, and give the medical treatment.
Right. You said, doctor, that in case the patient is deficient on certain, vitamins, minerals, etc., then you suggest them for supplements, etc. But the thing is, nowadays, because supplements are so easily available, over-the-counter products are so easily available, market is flooded again with supplements and vitamin gummies, and people
Gummies,
are going
yes.
for by themselves. They don't even go to the
I
doctor.
get
They don't
queries
even know.
about that. Yes.
Yes, they won't even test whether they are deficient or not. They'll go for biotin, zinc, etc., etc. What's your take on that?
So see, fads have always been there. So the patients, they come and so I have been writing biotins since ages. So then they just come to know that there's something known as biotin, and then the gummies. It's being advertised in the social media. So that's more of a fad. So the point I'm making is that unless you approach it holistically and you do not know what are your pre-exacerbating factors of your graying, and just blindly taking gummies is not going to help. So basically, if one doesn't know, and one is hypothyroid, or one has got some underlying autoimmune disorder, and one takes gummies, obviously it's not going to help.
It will increase their sugar level. It may increase their sugar level because they are full of,
Yeah,
sugar.
yeah.
But yeah, definitely one should go and consult the right person, which is a qualified dermatologist. Don't self-treat. Don't go by what your friends have done, what your relative have done. Go to the right person. Please don't waste your energy, your time, your money, and most importantly, your health on over-the-counter medication or products or gummies, supplements, etc. Go to the right person. They'll save all of this, plus your hair and your health. Now, doctor, how long do they need to continue with the treatment? When can they see the results come?
So usually, for hair, the scalp hair is growing by, let's say, 1 centimeter in 30 to 35 days. So whatever treatment we do for hair, it has to be continued for 9 months, maybe longer also. It depends on how you're responding. In addition, I would also say that we are now coming up with a lot of stem cells and peptides, and a lot of all these hair containing serums. So they can be applied, and they can be even at times, using a derma roller made to penetrate, or maybe using a mesotherapy, penetrate. So we can definitely, in case there are certain interventions needed of these, we can use those interventions and give home treatment as well, to give you a better result, and maybe better hair, and maybe increase the density of your hair also by 5 to 10%. Then all of this, but generally, as a thumb rule, 6 to 9 months of treatment would be required. At times there is a reversal also post-treatment, but not necessarily so if we are, diligent with our advice.
Okay, doctor, I'll quickly take few of the questions by our viewers. Ajit Singh is here. His question is, can excessive exposure to sunlight or environmental factors accelerate premature hair graying?
Yes, so it's a good question. So excessive exposure to UV light has been associated with gray hair. I think there is a proverb that "Dhup mein baal safed," like something like that.
Right.
Yes, excessive exposure to sunlight leads to, as I said, graying is due to accumulation of free radicals. As we age, we accumulate free radicals, and you should know that the process of melanization of hair generates a lot of free radicals. And if we do not have the enzymes, or they're deficient, they're copper containing enzymes, by the way, as I mentioned. So if the enzymes are deficient and the free radical scavenging is not happening, the graying will happen. So UV exposure also generates free radicals. UV rays can exacerbate aging. So they would exacerbate aging of hair as well as skin, for that matter.
Okay, and one last question by our viewer. Is it possible to reverse premature graying once it has occurred?
Now if we go into detail, there's something known as gray hair, and there's something known as completely white hair. And we should know that coloring is happening from the hair bulb. For your terminology, it's a root. But there are certain reserve cells in the bulge and in the outer root sheath, which if they are alive, we can, the hair which is not completely gone white, we can reverse it and we can definitely halt it. That's why I was saying that we can treat the reason in my previous questions. So
Right.
to an extent, yes, we can, provided we reach help early. We do not take it lightly. We do not resort to excessive coloring and spoiling it further, because color involves a bleaching reaction and then the oxidative reaction. So the thing is that if we start treatment early, we can definitely halt it and maybe reverse it to an extent also.
And doctor, any closing remarks for our viewers before we sum up?
So my closing remarks are that this is Hair Awareness Month, so pay attention to your lifestyle. Quit smoking, because smoking is a major cause of free radical generation and premature graying of hair. Follow good lifestyle and good diet and exercise regime and regular sleep hours. Though very difficult, but spend less time on the screen maybe. And yeah, I think we should be good with the hair. And in case you do have a problem, or if the graying is happening, or you have a query, do seek consultation with a dermatologist rather than self-styled estheticians or your friendly chemists or your neighbor or all and sundry. So it's best that you consult a dermatologist.
Thank you so very much, Dr. Gulshant. It was wonderful talking to you. Thank you for your valuable time and this very informative session. Thank you.
Thank you so much.
And viewers, thank you for your active participation in today's session. Stay happy, stay healthy, and keep connected. Stay connected with us. Thank you. Goodbye.